So the first thing I'm going to do is introduce myself as soon as I walk in, and then confirm my hospital order and policy, and then perform hand hygiene, identify my patient using two identifiers, Jaguar J. Jones, and medical record number 4176352, medical record number 4176352. Then I'm going to explain the procedure, and it says allergies. I see that he has a penicillin allergy, and I'm going to ask him if he has any other unlisted allergies that we need to know about. Then we are going to, I'm going to state three reasons that justify indwelling catheter placement. And those are acute ventilator-dependent respiratory failure, acute worsening of mental status, and palliative or end-of-life care. And so I'm going to do all of this while providing as much privacy to the patient as possible. But for my next step, I'm going to gather up all my equipment, which I have here. I'm going to don my goggles, and then place my trash can, or reposition my trash can, and then perform hand hygiene again. The next step I'm going to do is raise the bed, lower the side rail, and then position the patient in dorsal recumbent with their legs bent, which kind of hard to do with the towel. And then I'm going to don my clean gloves. Okay. And then so after I get my clean gloves on, I'm going to perform perineal care. For a female, you would start, at least being on this side, you would start from the distal labia and move from front to back, and then proximal labia front to back, and then midline front to back. For a male, you would start at the urethral meatus and move in a circular motion down the glans penis. After perineal care, we are going to open our urinary catheter kit, like so. We're going to place our box in between their legs, and we're going to actually go ahead and open this up. We're going to use this as our little temporary trash can. We're going to put that by their hip. Okay, and so now we're going to go ahead and open this up. We're only going to be touching a 1-inch sterile border right here. Make sure not to touch the kit. Okay, so there's that. And then now we're going to remove our gloves, glove to glove and skin to skin. And so I'm going to move this, and then now we would actually don our sterile gloves. Okay, and so we're going to do that by touching the inside. Okay, and then going inside or touching the outside of the second glove, and putting it on like so. And when I'm readjusting my gloves like this, I'm making sure that the sterile portions of my gloves don't touch the cuff, just so I maintain sterility. And okay, so now that I've got my gloves on, I'm going to go ahead and remove my sterile field. So, like so. And then we're going to put the shiny side down. Okay. And so now that we have our sterile field out, if we were working with a male patient, sorry, I actually just touched my the cuff of my glove right there, so that would be a contamination. I have to go get new gloves. And so now that I have new gloves, if we were working with a male patient here, we would actually use a fenestrated drape, but we're not going to be using that for this patient here. So the next step that we're going to do is we would place our plastic kit onto the sterile field, and then we would go ahead and add our lubricant to the tray right here, and then we are also going to go ahead and connect our, go ahead and set this aside, and I'm going to go ahead and connect my tubing, or my syringe, to the catheter. Okay, so now that I have done that, I am going to pick up my urinary catheter and remove the plastic from it. I'm going to dispose of that. And so at this point, we are going to lubricate the catheter. And so for a female, in this case, we're going to be lubricating the first 1 to 2 inches of the catheter. For a male, we would actually lubricate the first 5 to 7 inches. Okay, and so now with this lubricated, we're going to take our non-dominant hand, and then we're going to be contaminating it right here. And so we're going to spread this, spread the folds of the vagina, and perform a second perineal care, which we would be using our betadine strips, or betadine swabs, and we would be cleaning the urethral meatus of the vagina, as well as for a male, we would also start at the urethral meatus and move in a circular motion. So now that we have completed the perineal care, we would actually go ahead and we're going to move this box a little bit closer to them. And then we're also going to go ahead and tell them that if they needed to facilitate the procedure, we're going to ask them to either bear down like they're going to void, or just take deep breaths in and out, because we are about to insert the catheter. So now we're going to, with my non-contaminated clean hand, I'm going to begin advancing my catheter into the urethra. And so for a female, I would advance it 1 to 2 inches. For a male, we're actually going to, we would insert it all the way to the bifurcation. Well, actually, excuse me, we would insert till we get urine return. And then once we get urine return, we would insert 1 to 2 inches further for a female, and then all the way to the bifurcation for a male. And so now that that is there, we are going to secure this with our non-dominant hand and push our saline to fill the balloon. Okay. And so we're not going to release any pressure until now. Okay. And so now with that disconnected, we can release pressure and dispose. So now we're going to ensure that we're going to give it a gentle tug, and then we're going to back it up another 1 to 2 inches to relieve pressure off the neck of the bladder. And so now that we've done that, we are going to secure our catheter with a stat lock here. So we are going to open this up like so, and then move this over here. So we're going to go ahead and actually place the catheter into the stat lock. And I'm actually going to turn that around. Sorry. I'm going to insert the, like so, and then attach to the side of the patient, like so. And I would do this after I have wiped the leg with a alcohol wipe and let it dry, because this bandage does remove with alcohol, so we have to wait till it dries. And so now I'm going to dispose of those, and now I'm going to demonstrate taking a urinary sample. Well, I'm going to first of all secure the catheter bag to the side of the bed, frame, like so. And so I don't really have a good amount of room to do this for, but so taking a urinary sample, you would have to place your graduated cylinder up under the bag, and then you would take your collection cup, uncap, and place back with the cap up in the sterile kit. And then with this, now, say it's above there, uncork the valve here and press in this little button. And then once you've got the desired amount, close it off and, close it off and recap your collected specimen. I'm going to set that over here to the side, as well as our cup. So now that we've collected our specimen, we've got the indwelling catheter in, we would actually clean up all of our supplies. And so I'm going to go ahead and move all of this. Okay. And so now with all of our materials out of the way, we're going to remove our gloves, skin to skin, and glove to glove, and then replace or put in the trash can. Now we would perform hand hygiene, and then lower the bed, raise the side rail, assess the patient for comfort, and make sure that the call light and the comfort items that they have requested are nearby. And then now I'm going to perform hand hygiene again on my way out. And then in documentation, I'm going to be documenting the catheter size, the urine amount, color, consistency, as well as how the patient took the procedure, and any specimen if it was collected, and we have. So after that, I'm going to document that we will perform daily catheter care and care after instances of stool incontinence. And then we're also going to be discontinuing the catheter as soon as medically indicated as nursing-driven protocol. And so the next thing that we're going to do is, or the next thing I'm going to demonstrate is removing the urinary catheter. And so the first thing I'm going to do is confirm that we are to discontinue the catheter, and we have. So then I'm going to put on my goggles. I'm going to perform hand hygiene and don my clean gloves and and then explain the procedure to the patient, that I will be removing the indwelling catheter. And so once I finally get my gloves on, I'm going to be demonstrating or explaining how to empty the catheter bag. And so you would do that by okay, so now that we finally got that, you would take your graduated cylinder and then empty the bag or the contents into the cup, and then that's where you would get your measurement, and then you would throw or discard the liquid either in the toilet or the sink. And then afterwards, or after that, you are going to, or I'm going to get my, before we go too much further, I'm going to go ahead and lay out my towel just in case we have any liquid or come out, or just we want to keep everything pretty clean. So So now that we have that in place, we're going to go ahead and we're going to grab our 10 milliliter syringe. Go ahead and put that. Go ahead and take this off. And then we're going to loosen the plunger by moving it back and forth a couple times. And then draw it out to 0.5 milliliters. And I'm going to place back on there really quick while I release my stat lock and move to the okay, and then move to attaching this to the guard. And then now we're going to let the water drain out by gravity. And so once this finally, once the urinary catheter does drain, we're going to remove the catheter. And should be getting pretty close now. Okay, and so we're going to go ahead and gently remove the catheter and then wrap it in our absorbent pad, towel, and then discard away from the patient. The next thing that we're going to do is, well, we would remove this by wiping with an alcohol patch and then removing it off the patient and discarding that. But then we would perform peri-care for the patient, and then we would actually remove our gloves after performing peri-care. Remove our gloves and discard in our trash can. So after that, we're going to move to documentation, and we're going to be documenting the color, consistency, amount, and odor of urine, how the patient tolerated the procedure, the intactness of the catheter tip, the amount of water saline drained from the balloon, as well as monitoring the patient 4 to 6 hours after removing the catheter to make sure that they have void, because if they have not voided, we will perform a bladder care or palpate their bladder or a bladder screening.